Good afternoon, all of you. I'm Dr.Ruchi Sirodkar. I have a pediatric practice in Pune, and I'm a director of an organization which is called as Pediatric Children at Their Fittest. I am here discussing various drugs that we use in pediatric practice, and the drug that we are going to discuss today is Baryta Carb. Okay, so this is very oftenly used in pediatric practice. It is also used it can be used in various ages, but I am here talking about its usefulness in pediatric practice. Okay, so how will you identify a child, whether the child is calcarea or Baryta? So the case taking starts even when the child is waiting outside and when the child enters. So the Baryta Carb children are very timid, bashful, a lot of awkwardness. So when they come inside your cabin, they are usually hiding behind the mother, So either they will hide behind the mother or they will hide inside the table, they will go inside so that you cannot see them, or they will cover their face like this, and between the gaps of the fingers they will try to see like this. You can see these observations when you are in the clinic. So they would first hide. The first word of caution that I would like to give here is, every child who hides is not Baryta. There are some children who will hide. In my clinic, I have observed they will hide first and they will slightly peep outside, and again they will hide. So what they are doing over here, they're kind of playing a game of peekaboo, of hide and seek. So there we take playing desire to play hide and seek. Right? So if you consistently see that the child is hiding and not coming in front and shy and timid, this is the drug that you need to think of. Okay, and what else? So if you see the development of Baryta children, what is the problem in Baryta children is ailments from overprotection in childhood. Overprotection, parental protection excessive. There are only 3 drugs. So when the mother is talking, you can make it out, that the mother is very protective about the child. You can understand the way the mother is talking. I had a mother who used to come and say कि आज मेरा बच्चा ऐसे पैर हिला रहा था, या he was walking like this, is it not a problem? They would not like their children to fall. So any mother or any parent who's very protective about the children, you can think of only 3 drugs, that is Baryta Carb, Calcarea Carb, and Silica. This way your everything narrows down to few drugs if you start understanding the way mother talks, also the way the child enters. So it is not ailments from domination the way we see in carcinosin. This is overprotection of mother. So the child is so overprotected that all the milestones of the children are delayed. They become timid, they become bashful, they are always dependent. Even a Baryta Carb adult is very dependent by nature. They are not very independent individuals. So now start studying all the rubrics of Baryta Carb from this angle. This is the base of Baryta Carb, right? There's a rubric spineless, which Baryta Carb covers, even Silica covers, so they are always, spine is the part of the body which supports our body. So they are always dependent on others, independence, lack of dependency. So once you understand how the Baryta Carb, builds, you will be able to understand all the rubrics of Baryta Carb. So basically, if you see Baryta Carb, they are weak in studies. If any question anywhere you can ask, they are weak in studies. They take a lot of time to learn. They are late learning to walk, late learning to talk. They have a problem in reading inability in children. They have a problem in memorizing. So many of the children who come with these complaints, not all the children, can be think of Baryta Carb as a remedy. When you see that there is overprotection, there is there's a lot of care that the mother is doing and the child is very timid and bashful, you should think of Baryta Carb. So they have learning difficulties, they have memory difficulties. There is a rubric that if you keep teaching Baryta Carb one thing again and again, they cannot be taught. They forget the things that have been just taught. For example, the mother would complain, यार मैं इसको एक ही बात 10 बार समझाती हूँ, एक क्वेश्चन डिक्टेशन में 10 बार लेती हूँ, फिर 11वीं बार लेती हूँ, उसको आता नहीं है. मतलब मैं you would see the frustration of the mother कि यार मैं चिढ़ जाती हूँ कि इसको समझ क्यों नहीं आ रहा है, you know, why the child is not able to understand. So that is the difficulty that the Baryta Carb children face, and the mother would say there are some singular very nice rubrics of Baryta Carb. Memory weakness of mental exertion for children cannot be taught. उनको आप पढ़ा नहीं पाते हो. Memory weakness learned for just what he has. मतलब आपने अभी पढ़ाया और आप 10 मिनट बाद पूछो तो बोलते हैं नहीं आता, नहीं याद आ रहा. You know, there are parents who come with these complaints, you know, कि यार इसको हम कितना भी पढ़ा लें, मैं 1 घंटा समझा रही हूँ उसको, फिर थोड़ी देर बाद बोलता है कि मुझे नहीं याद है. Right? So, will none of his own, that is a rubric that we have not used, but it is very, इनकी खुद अपनी motivation will drive नहीं होती, इनको खुद नहीं लग रहा होता कि मुझे पढ़ना है. Even adults, you know, they don't have that drive. They are very narrow minded people, you know, जो चल रहा है अच्छा है. They don't have कि ambition loss of में Baryta Carb है. They really don't have that kind of zeal or ambition or desire to achieve. So will loss of में Baryta Carb है. None of his own, मतलब अपनी कोई will नहीं है, अपनी कोई desire या ambition नहीं है. Right? So I have explained how the child would enter, what is the background that you will have, and what you will see in these children when mother talk about. So these are the children who are not very confident, you know, when timid, bashful, awkward, drops things, मतलब आप हाथ में लेंगे कुछ गिरा देंगे बच्चे. मम्मी कहती हैं कि you know, if you ask the child, you tell your complaints, you will see that child is very conscious and awkward and timid, and the mother will say कि ये नहीं बता पाएगा, you know, I will only tell. Otherwise कई बार 10 years के 12 years के बच्चे जो आते हैं, they talk very confidently and they know what their problem there, but you will see Baryta Carb will not be able to, and the mother would usually tell his complaints. If they are not hiding also, you can give Baryta Carb. It is not necessary that every child who hides is Baryta Carb, और ये छुपा नहीं तो Baryta Carb नहीं है, ऐसा नहीं है. Right? So how will you see timid, bashful, hiding, not very good learners, not very intelligent, difficulty in memorizing? They will cling to mothers. But one thing is very peculiar about Baryta Carb is they are tidy in their appearance. Only appearance would be tidy. Proper too has Baryta Carb. We only have those, you know, fixed images and we say, okay, this is Baryta. No, you can see Baryta Carb in various other forms also. They will either cling to the mother or they will cling to the furniture, or if you ask, अभी बच्चे का environment क्या होता है? Family, school, you know, and friends. So when we take a pediatric case, you have to explore these angles only, or कि भाई बाकी friends. So Baryta Carb children do not have lot of friends, you know, because of their timidity, because of their dwarfishness. Of, you know, sometimes बच्चे बोलते हैं यार इसको समझा रहे हैं, खेल ही नहीं रहा, ये rules ही नहीं follow कर रहा, इसको समझता ही नहीं है तो हम नहीं खिलाते. So Baryta Carb children do not have lot of friends, you know. Baryta Carb में एक rubric है that delusion the friend is dying, or anxiety that the friend is dying, a close friend. वो क्यों है? Because उनके 1-2 ही friends होते हैं and they are dependent on them. So they always have that insecurity to lose that close friends. They even have that insecurity of losing people whom they are dependent on. Dependency किसी पे भी हो सकती है, you know, father, mother, grandmother, grandparents, friend, anybody. So these are dependent individuals. So they have fear of losing people on whom they are dependent. Are you all getting what I am trying to say? And when this feeling builds on that, you know, I am dependent, and they will have that fear that she is laughed and mocked of. मेरे पास एक बच्ची, of all the people I have given Baryta Carb, there is only one child who actually said, the mother said she doesn't talk to a lot of children, she doesn't have a lot of friends. I said, asked why? सब मुझ पे हंसते हैं. So that is the main delusion behind that timidity of Baryta Carb. You know, they have this delusion that she's laughed and mocked at being. सब मेरा मजाक बना रहे हैं, सब मेरे पे हंस रहे हैं. So that delusion makes her all the more timid and bashful and secretive and hiding, because that confidence is not there. अगर मुझे as a child लगे कि कि सब मेरे पे हंस रहे हैं, तो will I get that confidence to go and talk to people? No. And imagine with that dwarfishness of the mind कि जहाँ आपकी एक incapability है, यहाँ जहाँ आप slow learner हो, आपको समझ नहीं आ रहा और आपको लगता हो कि बच्चे मेरे पे हंस रहे हैं, तो what kind of personality would become? And internally they get disgust also. Disgust is a hatred. So there is a rubric: disgust oneself, no courage to live with oneself, So they start feeling bad about themselves. There is that confidence which is low. They feel that there is a rubric that walking on knees, delusion walk on knees, or delusion legs cut off. What does that mean? Legs, the way I said spineless, in the same way legs give you support and you are able to walk. तो they feel छोटा बच्चा होता है, वो क्या करता है, जब पहले क्रॉल करता है और कोई भी उसको गोदी में, अगर उसको इधर से उधर जाना है और वो नहीं जा पा रहा क्रॉलिंग की वजह से, तो कोई भी अडल्ट आता है और उसको गोदी में उठा के ले जाते हैं, राइट? So the same way the Baryta feels that they are still walking on knees. They need that support from an adult or someone, from a wife or from a husband to do things. So those, ये जो दो rubrics हैं, उनका ऐसा meaning है कि delusion legs cut off और delusion walking knees on walk, because you don't walk on your knees, you walk on your legs, right? And Baryta Carb is also used, अगर Kent को आप पढ़ें Baryta Carb को लेके, तो Baryta Carb is also used where one organ is not developed in children, the ill development of kidneys, pathological cases where neonatal आते हैं, there also you can use Baryta Carb. Baryta Carb is oftenly used in dyslexic, autistic, learning disability disorders. But again, every dyslexic child is not Baryta Carb. You can give Bufo, you can give any other Calcarea Carb or any other Lycopodium. It is a remedy to be thought of if the background matches, if the totality matches. You can think of Baryta Carb. And you suddenly ask a question, tell me about yourself. You will see that the child is not observant, So there is a rubric which is unobservant, We have seen in phosphorus how alert they are. In my recent Zoom session, I have shown a video of a 10-month-old baby suffering from atopic dermatitis, where the child was observing every movement of mine. I dropped a pen and the child was observing. I moved and the child was observing. So Baryta Carb children are not observant. They are unobservant. They don't know what is going on. They are lost. Absent-minded teachers will complain कि यार स्कूल में when we are teaching he is lost, he's not here. So absent-mindedness, you are absent from the present which is going on, right? In schools we have seen children who are not very attentive, so you can think of Baryta Carb. So I have discussed that they are timid, they feel that they are laughed, the people are laughing on them, so they hide, they don't want to come in forward. So क्या Baryta Carb बच्चे को गुस्सा नहीं आता है, या Baryta Carb वायलेंट नहीं हो सकता है? हो सकता है. तो Baryta Carb का गुस्सा कैसा होता है कि Baryta Carb has sudden fits of anger because of cowardice nature of them, because of their timidity. I am timid by nature and I am bashful and I don't have that confidence to go outside and talk, and if someone push me, तो मेरा क्या reaction होगा? I can become angry, I can become violent. They can have that sudden spurt of anger, मुझे नहीं करना है. You can see that more in adults or even in kids if parents try to push them a lot, right? So there is a rubric which is very interesting, which I learned now when I was preparing for this Baryta Carb, was cowardice, anger with sudden fits of. And then when you try to go behind this rubric, you understand why the Baryta have that sudden fit of anger, because of their cowardice nature, because of their inability to express what they want, because of their timidity, because of their low self-confidence, Yeah, so even one more rubric we have like this: anger, sudden cowardice with. Make a note of these rubrics, they are very very important. Otherwise you'll see, अरे ये तो गुस्सा आ रहा है, this is not a Baryta, Baryta is timid. Baryta को भी गुस्सा आता है, Baryta can also be violent. But when the Baryta with violent, जब आप उसको push करेंगे, जब उसको अपने cowardice की वजह से उसको गुस्सा आता है, वो कर नहीं सकता है, इसलिए वो अपना it is like an overcompensation of the things that you are not able to do. If I have timidity and I'm pushing someone, go on stage, I'm nahi jana yaar mujhe, things like that. So there you can pick Baryta in adults also. Baryta Carb children as well as adults are very narrow-minded people. I was reading about it and I realized that they can be, it is not that they are unsuccessful in life, they can be at a successful post, but they don't have that ambition or zeal to go ahead. जो चल रहा है ना, it is nice, इतनी ही सोच रहती है, इतना ही करना है. They cannot do lot of things at one go. So they have a narrow mindedness. एक typical approach, इतना ही कर रहे हैं, 9 to 5 जॉब कर रहे हैं ना, बहुत है. I really don't want to do something extra, जा रहे हैं ना क्लिनिक, जितने पेशेंट आ रहे हैं अच्छा है, that kind of an attitude. I am happy and jitne patient aa rahe, you will not see that hard work or zeal to do more and to learn more. Jo chal raha hai acha hai aise. But Baryta Carb is not in content. So why this attitude is because of that lack of business, business aversion to, or the lack of will, no sense of will he has for his own. Because of that Baryta Carb hai. So basic fear क्या है? Fear of strangers, fear of unfamiliar things, hiding from strangers, timidity from strangers. Stranger is something which is not known, मैं इसको नहीं जानती हूँ, ये मेरे लिए स्ट्रेंजर है. तो Baryta का प्रॉब्लम स्ट्रेंजर्स के साथ है. Baryta कुछ भी नया काम करने के लिए, fear undertaking new things में Baryta है. persevering in nothing, persisting in nothing. मतलब मैंने आज डांस क्लास लगाई, पहले तो मुझे लगाने में Baryta है, मुझे नहीं लगाना है, मुझे नहीं जाना है. आप एक बार पुश करो बच्चे को कि यार तू कर, यू विल बी एबल टू डू. फिर थोड़े दिन बाद मुझे नहीं करना है डांस, मुझे नहीं इंटरेस्ट आ रहा है, तो दे डोंट परसिस्ट इन एनीथिंग. कि अभी भरतनाट्यम क्लास लगाई है तो 4 साल लग के भरतनाट्यम सीख रहा है. Baryta का बच्चा नहीं सीखता है ऐसे. दे डोंट परसिस्ट, दे डोंट हैव दैट ज़ील, they don't have that MWD, motivation, will and drive to learn new things. तो Baryta हमेशा डिपेंडेंट रहेगा और उसको हमेशा ये डर रहेगा to lose the people whom they are dependent on, right? ठीक है. Anything else that we need to add? So what they would want, they want a familiar surroundings, people who are known, parents, grandparents. जो नहीं जानते, जो strangers हैं, वो उनको नहीं चाहिए. fear रहता है उनको. Okay, so it is also used in old age, muttering in sleep, old age in, imbecility, old age in, memory loss of old age in. हाँ, कहते हैं कि जो बुढ़ापा है वो एक दूसरा बचपना है, तो childish behavior, old age in, so that all we can think of Baryta Carb very strongly. और एक बात, Baryta is one of those drug who has बच्चे mostly play करना चाहते हैं. We have discussed belladonna का play, lachesis का play. belladonna इतना playful होता है कि वो एक बाजू में ये रखा है तो इससे भी खेल सकता है, या पानी से भी खेल सकता है, या हैंकी से भी खेल सकता है. इतना playfulness है belladonna में. But Baryta में playing aversion to play है. They would rather sit in the corner than play. तो अगर आप पार्क में देखोगे कि 10 बच्चे खेल रहे हैं और एक बच्चा साइड में बैठ के सिर्फ देख रहा है, you say why don't you play? No, I don't want to play. These are Baryta Carb, timid, lack of confidence, who doesn't want to play, that is why they don't have friends, and that is why they have a fear of losing a friend, because वो एक आधा ही friend रहता है जिस पे वो dependent है, and they don't want to lose those friends, right? So उनको क्या mainly Baryta का delusion क्या रहेगा कि they are laughed at, they are criticized, they are abused. yeah, they are not confident about their body also. Delusion, body, ugly looks, body looks. And there is a very peculiar delusion of Baryta that the mame are too small or too big. Usse bhi unka confidence, females mein kam hone lagta hai. Someone was asking about Baryta female. So they have that delusion in their mind that, because my breasts are very small, so they feel low in confidence. Ye bhi delusion hai Baryta mein. So they have very low confidence about their body also. उसको लगता है कि आई एम नॉट लव्ड, आई एम फोरसेकन, आई एम फॉरगेटफुल. माई फैक्ट भी है और उसका ये डिल्यूजन भी है, उसके दिमाग में बैठ जाता है कि दे आर they are forgetful by nature. And Baryta always feel that people are looking at me, so everybody is looking. That is why they become more conscious about it, that people are looking at me, people are talking about me, watched she is being, कि सब बच्चे मुझे ही देख रहे थे, या वो लोग मेरे पे हंस रहे थे. Maybe they are not, maybe there's a group of people, children who are laughing on their own, but इसको Baryta को लगता है कि they are laughing at him. जब हम ये रूब्रिक्स पढ़ते हैं तो हमें बड़ा ट्राई टू अंडरस्टैंड देम इन द लोकल लैंग्वेज. अभी अगर हम जिस्ट बनाए Baryta का, तो Baryta कैसे आएगा अपने क्लिनिक में? ऑकवर्ड आएगा, टिमिड आएगा, बैशफुल आएगा, छुप जाएगा, या वेरी लो इन कॉन्फिडेंस, या फिर देयर इज ऑल्सो रूब्रिक हाइडिंग बिहाइंड मदर. आई हैव लॉट ऑफ चिल्ड्रन, जब वो आके मदर बैठती है उनके पीछे चेयर में जाके छुप जाते हैं. हाँ, तो that is the Baryta. And when you start talking to mother, you will understand how protected mother is, how so much of protection mother has given. So that she will be constantly, yahan mat khel, गिर जाओगे, sit down, and half of the attention of the mother would be on the child, कि child को ठीक है ना. So in that 5-10 minutes also you can understand Baryta. And what will be the complaints of mother? He is very weak in studies, I have to teach him so many times, but you do not get the full picture of Baryta in one child. So again and again I always tell, it is the question of evaluation. You have to understand when the child comes and hides, what is the behind it. वो खेल कर रहा है क्या, वो प्लेइंग हाइड एंड सीक कर रहा है, या टिमिडिटी की वजह से हाइड कर रहा है, या वो डर रहा है स्ट्रेंजर की वजह से. आपके पास lot of children enter into your clinic and you understand that they are scared. There you have to understand what they are scared of. Are they scared of a stranger, or are they, as is in Baryta, or are they scared of that injection? और मम्मी पापा बोलते हैं नहीं यार ये होम्योपैथिक डॉक्टर हैं, ये इंजेक्शन नहीं देते हैं. मामा पापा आर गिविंग दैट कंसोलेशन टू द चाइल्ड एंड द चाइल्ड इज स्टिल स्केर्ड. तो उसको वो हाइपोथैलेमस भी हो सकता है, क्योंकि उसको फियर बिट्रेड है, कहीं इंजेक्शन ना लगा दे. स्ट्रिमोनियम भी हो सकता है, पर स्ट्रिमोनियम का क्या होता है, जब वो डर में आता है दे श्रीक. देयर इज अ रूब्रिक इन स्ट्रिमोनियम. I have given so many children with this rubric. बच्चे मम्मी पापा की गोदी में होते हैं, वो जोर जोर से चिल्ला रहे होते हैं, and they are मतलब क्या, they want to go outside the cabin, they want to escape from the situation. So escape desire to shrieking with. This is a very very important rubric of strimonium. I have given to so many children and I have successfully treated with this symptom, where the child wants to escape and go out of this room and they are shrieking. Why? Because they have that strimonium में fear injury का injection ना लग जाए, इसका डर है. लाइकोपोडियम में fear entering room है. Are you understanding? बहुत सारे बच्चे डर के आ सकते हैं, या बहुत सारे बच्चे मन में डर हो सकता है और दिखाते नहीं नहीं मुझे कुछ नहीं लगता, आई एम वेरी कॉन्फिडेंट. एंड आप मजाक में बोलो ठीक है मैं इंजेक्शन लगाती हूँ. नो 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 नो, दैट इज व्हाट, दैट इज अफेक्टेशन चिल्ड्रन इन. सो एवरी जेस्चर, एवरी मूवमेंट, every small thing tells so much about children, especially, and more than words, their gestures, their eyes, where they are looking, what they are interested in the clinic. So you can keep small things, a cartoon character ka kuch you can keep, or toys or toffees, and then you understand the child, what the child is trying to do. So we have studied Baryta Carb in detail. There are some more rubrics. There is mother fixation, because they are dependent on mothers, and they have a tendency to nibble. Nibble क्या होता है? एक बार में खाना नहीं खाते, थोड़ा खाते हैं. We have someone is asking what is the differentiation between calcarea carb and Baryta carb. We have discussed calcarea carb also. See, calcarea carb का problem ये नहीं रहता कि वो इनकेपेबल है. Baryta carb एक तरीके से dwarfishness है mentally and physically मतलब all these milestones, and mentally मतलब he has that inability, right? Calcarea को inability नहीं रहती है. Are you understanding? Baryta is also present in spoiled children. You know, spoiled children मतलब इतना protection मिलता है, जैसे बोलते हैं ना बिगड़ गया लाड़ प्यार में. That is spoiled. This is also a very important. Moscus I have prescribed once for this rubric, spoiled children. Yes. So where were we? So a lot of problems in learning disability and this timidity and the weakness of memory and that will that is lacking in Baryta. Okay, so last 5 to 10 minutes, it's been 30-45 minutes. So last 5 to 10 minutes we'll take some queries and then we can just end this live session. So there are various drugs that we have discussed till now. We have discussed lycopodium, calcarea, difference between some small rubrics, agaricus we have discussed. So you can go on, make the note of these rubrics, try to understand. If you have any difficulty, you can go back or come back to me and we can try to solve as much as I know and we can read about it. So any queries for another last 5 minutes? I had taken one Zoom session earlier and it turned out very, very good. We had almost 30-35 participants in that. I'm planning one more, which is on 19th of September in the afternoon, 3 to 5, and that is a Saturday. And we are charging a minimum 200 rupees for that session. So whoever wants to register can contact me. I'll drop my number below this. And the topic for that Zoom session is 50 important rubrics of pediatric practice. So whatever I have learned in these 15-16 years of my practice and reading, probably we can find a little way of small rubrics where we can pick up drugs which we sometimes miss. So maybe support him or he's interested in girls' private parts and all that. So जो sexual desire बुफो बच्चों में रहती है ना, वो बहुत high रहती है. बुफो बच्चों के लिए बोलते हैं shamelessness रहती है, वो कहीं भी शुरू हो जाएंगे, without knowing. So that is very, very characteristic of buffo. You need to have that. That child I gave buffo and he responded very, very beautifully. His speech was developed, and next time, after say 2-3 months only, I had given buffo 30 diya tha, then I gave 200. After some days, those activities completely stopped. He stopped masturbating and he stopped, asking girls to show their private parts in that special school. उस school की principal ने भी मुझसे बात की, and that was the major concern that they were having. He's troubling the girls like this. So that child responded very nice with buffo. So next video उन्होंने भेजा था मुझे, वो the child was singing Jana Gana Mana Pura, and that was very, very nice, to see a child who didn't had any speech and after 3 months he is able to sing Jana Mana Mana. So that is buffo, and there is so much more to buffo also, but I'm just telling one angle where I have prescribed because that only strikes me as of now. Okay, anything else? So we are planning to take such remedies and we are planning to differentiate it with other remedies, and side by side because we cannot show private videos of patient on Facebook. So at the same time, I'm trying to conduct these small Zoom sessions. Probably we'll be doing 2 this month, but I'm planning to do once a month at least, so that we can keep it with. So, and please come ahead. Thank you.